A very good afternoon to all of you. I'm Sayukta from Beautiful Spotless Skin Team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern, especially for women in their 20s. However, it would be wrong to say that men don't suffer from acne. To many, acne is also known as blemishes, blackheads, whiteheads, pimples, cysts. It is also most common during puberty and adolescence. According to recent data, almost 80% of the people in the age group of 11 to 30 years have acne outbreak at least once. Although acne most commonly does not have any serious health concern, but is de-stressing for the sufferer, the faster the issue is diagnosed, more effective will be its treatment. Thus, knowing about acne management from an expert is essential. And for this, today we have Dr. Alisha Zaidi, a consultant dermatologist from Lucknow, live with us to educate us more on acne management. Dr. Alisha is a medical director at Dermacor Health Medic Hospital, Lucknow. With her expertise into clinical dermatology and especially in today's topic, Dr. Alisha will enlighten us on management of acne. A very warm welcome to you, Dr. Alisha. Welcome, and it's a pleasure to have you with us.
I'm sorry, I'd just like to correct you. It's Dr. Aliza.
I'm so sorry, Dr. Lisa. A very warm welcome to you, Dr. Lisa. And today we are going to talk about a very important topic, which is acne management. Now, to start with, we would like to understand what is acne.
See, acne is basically a chronic or acute inflammatory condition. It involves the pilosebaceous unit, which basically comprises of the sweat gland or of the sebaceous gland and the hair follicle. What happens is due to excessive oil production or sebum production on the face, those pores, those pilosebaceous units get clogged, which leads to the acting of a bacteria known as P. acnes or Propionibacterium acne, which is the most common organism for acne vulgaris, that acts upon the sebum and causes a flare of bacterial infections. Acne is mostly of four types, four grading according to us, which is depending upon the presentation as well as the severity. And it can involve, it's mostly in the adolescent age groups, but nowadays it can be seen in the young children as well as in the ages more above 30, 35, even 40 years of age, which is known as in our terminology as acne tarda. And P. acnes, as I told before, is the main causative organism. And it is commonly the sites which we see is the face, but face is not the only site which is mostly involved. It can involve the trunk, the back, the arms, and it can even occur at the back of the hairline. That is also one of the common sites where we can see acne.
Right. So, Dr. Eliza will talk about all these in detail during this session. But now we would like to also understand what causes acne or what are the various causes responsible for acne.
See, acne, the most common cause which we see is puberty. Of course, when the children, the adolescent age group is the most common age group of presentation. So puberty is one of the most common causes with that, because with that there is increased sebum production, there is hormonal production in the body, which gives the skin manifestations as acne. Apart from that, there is overactive oil glands or sweat glands over the face, excessive sweating over the face that can also cause acne. Certain medications are there which causes acne in young females and in females, especially in the age group of 18 to 29 or 30. We are seeing a hormonal pattern of acne because it could be due to high emotional stress, any sort of stressful lifestyle which they are leading. Or in COVID times, we've seen a very common pattern of acne known as maskne, which happened because of the accumulation of dirt and sweat over the areas which were concealed under the mask. And apart from that, the less common causes are there is altered insulin resistance, high GI index food which are being consumed by nowadays by the young generation. I mean, in any age group, I won't target the young generation per se. Then there is a very common cause which we ignore is a dirty mobile. Mobile is like the most common thing which we are holding in our hands 24/7, and we don't clean the surface very often. We were very much cautious during the COVID times to clean it with alcohol and all the time, and with sanitizers. But now it's a very common cause. It has a lot of dirt accumulation, and as soon as you put it in the mouth, we put it on each cheek and in our hands, and we touch the face along with it. So it causes the activation of bacteria, accumulation of bacteria on the face. And there is a very common cause of using OTC products, over the counter products, especially the steroids. There are a lot of creams which are available in the market very easily, which as soon as you go to the chemist, they will give you. Even nowadays, a lot of cosmetics are using those steroids because they give faster action. But at the end of the day, they are even harming your skin even more. I mean,
All right.
there's a terminology which we know as acne form eruptions, which is typically seen with the acne, with the steroid use on the face.
Mhm. So, in short, we can say there are n number of factors responsible for acne. And as you were talking about our mobile phones, yes, a study says that our mobile phone has more bacteria than the toilet seat. So we can
Absolutely.
imagine, no wonder it can cause or aggravate acne. Now, doctor, as you said, over-the-counter medication can cause or aggravate acne. Now, the fact is, whenever, because all of us has once or twice or many times gone through this phase of acne breakouts, right? Now, the thing is, whenever we see something abnormal on our skin, first thing we do is try some home remedies. Or, as you said, going to the chemist वाले भैया से पूछ लो कि भैया acne हो रहे हैं, pimple हो रहे हैं, कुछ दे दो. Now, as you said, over-the-counter medication could be, harmful or dangerous for our skin or can make the acne worse. I would like to understand about both the things, home remedies or over-the-counter medication, how, it worsens the acne and damages our skin even further.
Okay. See, in over-the-counter medications, we have a lot of medications like you must have all those Ayurvedic, and I mean, I'm not targeting the Ayurvedic or Unani, but I'm just saying they're using some or the other steroid, either in mild concentration or in more concentration. And there is a guideline which we follow as a dermatologist, like to prescribe which cream to be prescribed to what age group or what type of acne. A lot of patients are using isotretinoin, that is a vitamin A analog, which is one of the drugs which we use for treating acne, which shouldn't be used in some specific conditions and some specific age groups, but they are using it. And similarly, as I said before, it's with steroid, because with excessive steroid usage over the face, there are various side effects which you see. Like the patients will complain of excessive redness on the skin. There'll be burning of the skin. They might have excessive breakouts or pigmentation, which will initially lighten and then darken because your skin has become accustomed to steroid use. As soon as you withdraw the steroid, or as soon as you withdraw these OTC products, it gives you a flare. And regarding the home remedies, yes, I've come across a lot of very weird and funny home remedies. I mean, it's a very basic thing. As soon as acne aata hai, to ghar mein nani dadi, everybody says ke multani mitti laga lo and neem ka tel laga lo, and a very common thing, toothpaste laga lo, raat mein laga lo, morning mein you'll see there's a clearance of acne. So please, I would say, don't do all these things. Go and consult a dermatologist. Let them form a treatment plan for you, so that you have a best care without having any acne scars or any pigmentation left.
Exactly. The irony is जब किसी से पूछा जाता है कि अगर एक्ने ब्रेकआउट हो रहा है, आप डर्मेटोलॉजिस्ट के पास जाइए, तो वो कहते हैं कि नहीं नहीं, डर्मेटोलॉजिस्ट तो स्टेरॉइड्स देते हैं. And what they end up doing, खुद केमिस्ट शॉप से जाके unknowingly they end up buying steroids and start using them even without knowing कि क्या वो कर रहे हैं, क्या लगा रहे हैं. इसलिए बहुत जरूरी है कि हम एक क्वालिफाइड डर्मेटोलॉजिस्ट के पास जाए. पूरा कॉज इस सेशन को करने का यही है कि हम आपको व्यूअर्स अवेयर कर सके कि कितना डेंजरस होता है सेल्फ मेडिकेशन और कितना जरूरी है कि हम फर्स्ट प्लेस पे ही एक एक्सपर्ट के पास जाए, और इस केस में एक एक्सपर्ट है, एक क्वालिफाइड डर्मेटोलॉजिस्ट. Now, again, as you were talking about mask acne, mask की वजह से किस तरह से acne होते हैं जो पिछले 2-2.5 साल में after COVID बहुत commonly देखने को मिले. Now, the thing is, many people complain that with weather change or due to excessive heat or excessive sweating or humidity, they get acne on their face. Now, what I'm trying to ask is there a correlation between season or weather change, etc., with acne? Because again, in mask acne, as you said, it's because of the sweat and the others that get accumulated under the mask that causes acne. So season change, weather, इनका भी कोई relation है acne से?
Yes, absolutely. Basically, in हमारे country में, we are mostly seeing the hot climate, and there is a spell of the humid climate.
Right.
Humid climate is, of course, it causes excessive sweating. It causes the sweat to accumulate. It doesn't let your sweat dry out. And a lot of us who are working very hard in their jobs, they don't get time to, wash their face 2 to 3 times a day, or even twice a day. A lot of people do not even get that much of time. And they and in females, it is most commonly seen because they apply makeup, and then there is sweat production, and there is collection, and then there is a, they're traveling with public transports or anywhere. I'm not saying any public transports, anywhere, whether you're having pollution, you're having that humidity, which will cause the bacteria to accumulate on your skin. It will clog the pores, and it won't let your skin breathe. So naturally, all the acne will flare up. As soon as there is any bacterial infection, it will flare up.
Right.
There is definitely a positive correlation between the weather and acne.
Fair enough, doctor. And as we normally say, that prevention is always better than cure. Any way to prevent acne breakouts?
Yeah, of course. What I would recommend to everyone, at least start, don't over exfoliate your face. I mean, it's a very common thing. We are having a lot of face washes and everything with scrubs. Don't scrub unnecessary your face. Don't over exfoliate, because it causes your pores to open, and then you don't know how to close them. I mean, there is a regimen you need to follow, your skin regimen you need to follow to close your pores. You should always use a mild cleanser, not a very harsh one, and always apply sunscreen. For acne, any patient who is having an acne prone skin, I'd recommend go for a salicylic acid or tea tree oil based face washes or cleansers, which will, of course, would not allow the excess oil to collect on your face. It will leave your skin fresh.
Okay, so we need to follow a regular skincare regimen, and we
I
will try
must add,
to.
I'm sorry, I must add one thing which everybody ignores. Please use a sunscreen. Don't ignore sunscreens. Sunscreen, because sun damage, another cause which will deteriorate your skin before your age.
Yes, as you have emphasized so much on sunscreen, I think we need to, talk about it in detail, especially because, with acne-prone skin or people who have acne or acne-prone skin, they have this notion in their head that sunscreen is going to make it worse. Anyways, in India, despite the heat, humidity, etc., 67% of people are not using sunscreen as a regular, thing or in routine. Now, the thing is that, especially with the acne prone skin people, they have all the complaints about it, saying that it makes their skin very patchy or dull, or that white cast is a problem for them. After using sunscreen or applying sunscreen, they tend to sweat a lot. Now, how would you like to address all the complaints or excuses people normally use to avoid using sunscreen?
See, in an acne patient per se, I would say there are various medications which we give for acne, which make your skin even more photosensitive. So a sunscreen is a must, like benzoyl peroxide. We typically ask the patient to apply in night. That is one of the reasons, because it makes your skin more photosensitive. We don't want you to go with come up with more pigmentation. So we recommend a sunscreen. Now, we are fortunate enough, we have so many sunscreens which are non-comedogenic, because they are not, that means that they are not clogging your pores. They won't cause the formation of blackheads or whiteheads on your face. And the second thing is, we have gel base, we have matte finish, and the physical sunscreens also, they have been now modified to an extent that they do not leave that white cast on the face. And a very big, I think it'll be a boon it is a boon in this sunscreen society, especially for us females. We now have tinted sunscreens which have that little bit of coverage which you need to make your skin look flawless, and you have that confidence to go out. I mean, don't take sunscreen as a sunscreen, take it as a necessary medication to treat and heal your skin.
Exactly. And then, people have all these, statements saying that I don't go out. My exposure under the sun is way less. So I'm mostly working from my home, or I'm a housewife. So most of the time I'm, inside the kitchen. So why should I use sunscreen? Again, with sunscreen, it is said that you need to reapply a sunscreen as well. I mean, it's just not that you need to apply a sunscreen, reapplication, the right amount of sunscreen you take to apply on your face, neck, or the body exposed is also essential. But then people say reapplication. I mean, what's the need? I've already applied it once. Again, your comment on that.
See, it as you said, it's a very common thing I get to hear mostly. So I tell them, say, even if you're going outside the gate, or you're going on on your roof, or you're even just going out to buy vegetables or anything, you are exposed to sun and you are damaging your skin in that part only. It mostly, I'd say, it not acne, and especially in the cases of melasma or pigmentation, which we treat, where we are giving demelanizing agents. They especially require a good coating of sunscreen over your face to prevent that skin, which we are trying to depigment. And excessive exposure of sunscreen will cause the skin to even more pigment. It will cause the pigment to darken. So we tell them, even the and of course, nowadays in our offices, in our homes, we have these fancy lightings which are very bright on the face. They are also photo damaging your skin. So that's why I tell them sunscreen is a must, even in your home, in the enclosure of your home. And regarding reapplication, I would say, of course, it's important, because as I said before, we live in our country, we have the summer season or the humid season. And in those cases, there's excessive sweating. You keep on washing your face. Like in our household, we the females who are working in the kitchen or anything, they keep on washing their face, because that you're removing all that sunscreen which you had applied in 8 a.m. in the morning. That's why it's very important to reapply it. That is what I explain it to them.
Okay. And doctor, you also mentioned that, yeah, sunscreen is essential. Take it as a, medicine. But you also said that it's important to maintain a regular skincare regimen. Now, we would like to, know what this skincare or a basic skincare regimen could be like.
See, as I said before, there should be, for specifically acne prone patients, there should be a non-comedol, salicylic tea tree oil, or in some cases, glycolic acid based cleansers or mild cleansers. If you have a very sensitive skin, please go for a mild cleanser. We have a variety of them.
Right.
And after cleanser, apply a good moisturizer, which should be, as I said, non-comedogenic, because we don't want the pores to clog. A lot of patients nowadays, there is a very much in the it's very, hearing from a lot of patients that we apply vitamin C, want to apply hyaluronic acid. So yes, please, if you want to apply, go ahead, but please check in the product whether it is oil based, whether it is water based. I'd recommend to the acne patients to use water based or chemical serums, because then of course they won't make your skin very oily. And the last layer should always be of sunscreen, which should be generously applied. I mean, it's a very common thing. Applied on the four fingers, and this much should be the coverage for your face and neck.
Okay, okay. And as you said, cleansing is very important. Moisturizing is very important. We'll start with the cleanser. Now, the thing is, many times oily face people, because they are mostly, prone to acne. Now, they have this notion in their head that if I keep on washing my face with a cleanser, it will, keep the oil away and keep me acne free. Is it correct?
No, over cleansing and over exfoliation damages your skin repair, skin barrier, which is like the covering on our skin, which is preventing us from a lot of pollution, from the harmful chemicals and everything. So I tell them, one, if you using the cleanser with the right ingredients and according to your skin type, you won't need it so often. I mean, 2 times a day, maximum 3 times a day is sufficient. As I said, the products in the I'm sorry, the ingredients in the cleanser should be of that sort, which will not allow the oil to accumulate on your skin.
Right.
And in such scenarios, now we have a lot of other brands of dermatology who are being there on OTC as well, who are having all these ingredients. But of course, as I said before, please check with your dermatologist first.
Right.
Please go and apply right away.
Right. So even in, you are not sure about which product to buy, or, what is your skin type and which product will suit you, just go and check with your dermatologist. They'll help you in doing that. Now, again, the next part, as you said, that after cleansing, it's important to moisturize your skin. Now, again, acne prone people, have this thing that I already have the acne prone skin. I'm already oily. Why do I need to add more, moisturizer on my face?
See, moisturizer, as I said, it will that I said that over cleansing will destroy your skin barrier. Moisturizer will prevent the skin barrier. It will protect the skin barrier basically. And as I said, we have gel formulations, we have non-comedogenic cream formulations, and in a lot of patients whom we are giving isotretinoin as an oral treatment for acne, or even in topical, after some time they experience a lot of dryness on their face and they don't know what to apply, and then they apply weird things like some people apply coconut oil, and my god, it's like another one flare of acne which we see after that. So yes, that's why I always tell them it's important. You may not need it now, but after, when you are in the right treatment protocol, then you will need a moisturizer in some time. So please do start using one. I don't tell them to apply it generously all over the face. They can start at small amounts and then increase as their need. But of course, it won't increase the acne.
Okay, so in short, we can say that we need a cleanser, a moisturizer as per our skin type and the condition we are in, and a sunscreen, of course, as a regular skin care regimen. It's very basic. I mean, all of us can afford it. Plus, spare the time that hardly takes any time to follow this very simple skincare regimen. Please start doing it right away and be very consistent about it. And in case you have any doubt, go visit a qualified dermatologist rather than going for home remedies or over the counter medication. Or many times, what happens, I'm sure, Dr. Aliza, you must have gone through the same, because people will just go and ask their friends or families who have gone through acne breakouts and who has followed prescription. So they'll, borrow their prescription and start medicating themselves. I'm sure you must have seen patients like that. Now, what would you like to tell them as well?
Yes, absolutely. I've seen a lot of patients like this, and a lot of times, actually, the acne which is there in the adolescent is because of the excessive sebum production. But once you cross that adolescent age group, then the acnes are mostly hormonal or due to any other cause. If it is hormonal, then the prescription which was being followed for a 15-year-old won't work on a 25-year-old. It's as simple as that. It
Right.
might work for some time and it won't, but in long run you won't get relief. And then comes the next problem is that with acne, if it is not treated according to their specific timeline, then they'll start picking on those acnes, and then that will cause scarring. That is another problem the
Mhm.
patients do not consider. They're like, they just need an immediate response. And in these cases, that's why I say it's very important to work up what is the cause of acne, what is basically the cause in which specific age group which we target. Like as I said, hormonal acne, I'm seeing a lot of hormonal acne nowadays. A lot of females are coming with me, and now the criteria of PCOD, it's a very common thing of PCOS. I think uh, her every fifth or sixth female I'm seeing some symptoms of PCOS in them. So for PCOS, we have a specific criteria, but sometimes the patients do not fit that specific criteria, but they respond to the medications. So we need to identify the cause, and we need, as you said very correctly, please visit your dermatologist to identify the cause. And there is a specific treatment protocol for every patient. It's not like we have this one protocol which we follow for everyone. Some patients respond to some medication, some patients do not some patients respond to some other medications. Even we as a dermat, we also need to we can't put everyone in one frame. So similarly, don't put yourself also in one frame. As I said before, a 15-year-old prescription won't suit a 25-year-old. So yes, you
Exactly.
need a doctor's guidance in that.
बिल्कुल, तो क्योंकि कॉजेज़ अलग-अलग हो सकते हैं, होते ही हैं, इसलिए बहुत ज़रूरी है कि हम उस कॉज़ को डायग्नोज़ करें और कई बार होता है कि जब आप एक्ने के लिए डॉक्टर के पास जाते हैं और डॉक्टर अगर कोई टेस्ट कराए या इन्वेस्टिगेट करे तो पता चलता है कि कोई अंडरलाइंग मेडिकल कंडीशन है, कोई हार्मोनल इम्बैलेंस है, पीसीओडी है या बहुत तमाम दूसरी चीज़ें हो सकती हैं। तो इसीलिए बहुत ज़रूरी है कि हम सही इंसान के पास जाएँ जो कि है एक क्वालिफाइड डर्मेटोलॉजिस्ट। कुछ सवाल भी मैं ले लूँगी हमारे व्यूअर्स के। हमारे साथ रक्षा है, पूछ रही हैं कि पिंपल्स कौन से विटामिन की कमी से होते हैं?
ओके, पिंपल्स एज सच विटामिन की कमी से तो नहीं, ओवरऑल योर आपकी बॉडी हेल्थ, आपकी पूरी बॉडी हेल्थ मेंटेन मतलब करती है कि हाउ योर स्किन ग्लोज। लाइक बहुत सारे लोगों में जिनमें दे आर यूजिंग सम काइंड ऑफ मेडिकेशन, कोई एक ऐसा मेडिकेशन खा रहे होते हैं जिसके साइड इफेक्ट्स से आपको एक्ने आ सकता है। जैसे एज आई सेड बिफोर, टॉपिकल स्टेरॉइड्स की बात हुई थी, ओरल स्टेरॉइड्स या जो हम ओरल एंटी ट्यूबरकुलर ड्रग्स खा रहे होते हैं, और ऐसे बहुत सारे प्रॉब्लम, ऐसी बहुत सारी मेडिकेशंस हैं जिनसे हमारा एक्ने फ्लेयर कर सकता है। But generally, I'd say you should have a, I mean, you should be taking a multivitamin with zinc in that. So that will provide that anti-inflammatory effect also, and it will take care of your acne also.
हुँ। अब चूँकि रक्षा ने विटामिन की
And
बात की है।
oh, sorry, I forgot to mention vitamin E should also be included. Vitamin E is one of the most common. Vitamin C and vitamin E should also be included in the regimen, because that is one of the most common causes. जो generally when we give them the in their oral regimen, so they respond to the acne.
फेयर एनफ। डॉक्टर, चूँकि विटामिन की बात चल रही है तो खाने-पीने पे भी हम बात करना चाहेंगे। आपने इनिशियली भी बोला कि बहुत ज़रूरी है कि हम ऐसी चीज़ों से दूर रहें जो लाइक बहुत ज़्यादा जंक जिस कैटेगरी में हम रखते हैं। तो क्या खाना चाहिए, क्या नहीं खाना चाहिए, क्या अवॉइड करना चाहिए? कोई डूज़ एंड डोंट्स इन टर्म्स ऑफ डाइटरी प्रिकॉशंस?
Actually, it's a very debatable topic, dietary, but yes, I would definitely say कि stay away from, I mean, cut down. I won't say totally stay away, but cut down on your dairy intake, cut down on your trans fats. And specifically जो आजकल जो fried foods अपने हमारे चले हैं, easy, just go heat and eat those
रेडी टू ईट,
are ready to
इंस्टेंट,
eat, because
या
they contain a lot of preservatives जिनके बारे में हमें नहीं पता है, and वो आपकी कौन सी condition को flare up कर रहे हैं वो हम अभी नहीं आपको एग्जैक्टली नहीं बता सकते। Apart from that, yes, I would say go for a good, I mean, consumption of nuts. There should be good consumption of nuts in your diet. There should be consumption of probiotics and prebiotics. There should be consumption of whole grains, and all the healthy fats. Omega-3 fatty acid rich food should be consumed.
Okay. Neha Chaudhary is asking, can aloe vera be used to cure acne in teenagers?
Yes, aloe vera, I'd say there is no harm. Aloe vera is a good moisturizer. It is a good, I'd say, in hair, it is wonderful as a natural conditioner. Aloe vera can be used, but yes, please do not combine it with other ingredients. Right, a lot of people that they keep on creating their own mask. Somebody's adding orange peel in that, somebody's adding a lot of things, and don't go for those aloe veras which are available in the market which have something or the other mixed in it. If you want, please have an aloe vera plant, or take natural aloe vera and apply it to face. It will definitely give you the good moisturization effect.
Okay, so Priyanka Rajput's question is, does lack of sleep cause acne? And I would like to add to it, doctor, does stress cause acne?
Absolutely. Stress has a major impact on acne, and I would say it causes a major impact on a lot of dermatological as well as psychological diseases. See, if you're not healthy in mind, it won't reflect on your face. So if you are in stress, people tend to do stress eating. They tend to do, they tend to take other things. Their diet is not that well, which will have prebiotics and probiotics, which will help in acne, which will be preventive in acne. So yes, stress does play a major role, and long working hours, long traveling hours, they definitely lead to a flare in the acne. And as you said, lack of sleep, because you are not giving your skin that time to recover. So when you're not giving the time to recover, then your skin is not that fresh. And as I said before, a fresh skin is like, it should be the baseline. That should be that is most important. I mean, whether there is acne or anything, but a healthy skin is very important. We're not talking about scars, or we're not talking about any pigmentation, but yes, a healthy skin should always be there.
Right. And as you mentioned scars, and even before when we were, answering various queries, you said that once, acne is one concern, and scarring is another concern. And many times it happens, people do complain, acne to chale jate hain, scars nahi jate. तो scars हो ही ना, क्या कर सकते हैं हम इसके लिए? And once, we have these scars, what is the line of treatment like?
या सी स्कार्स इसलिए होते हैं बिकॉज एक आदत होती है बहुत कॉमन सी के इफ देयर इज समथिंग वील जस्ट पिंच इट, we'll
Yeah.
pinch it, we'll keep on touching it the entire day, and when you keep on touching it, you pinch it, then you create a scar. And जो आजकल इट्स अ वेरी कॉमन थिंग कि एक लोगों के दिमाग में है कि हम स्क्रब कर लेते हैं तो हमारा एक्ने ठीक हो जाएगा. नो, that over exfoliation is also causing scarring because you're rubbing those active acnes. Don't rub those active acnes, don't touch those active acnes all day long. And as you mentioned before, please see a dermatologist. They will give you the right products which would have an effect on the acne, as well as they will minimize your scarring.
Right.
And yes, please.
Yes, doctor.
Yeah, and coming to the second part, you said कि once there are scarring, so what to do? So we have various treatments available for scarring, but of course don't try them at home. Please, it should be done in at a dermatologist clinic under the supervision of a dermatologist. There are various chemical peels. There are various procedures which we do. Micro needling we do PRP, that is platelet rich plasma, which is also known as liquid gold, which helps in the formation of new collagen and elevates scarring. And then of course we have lasers. Fractional CO2 laser is gold standard for scarring. MNR, microneedling, radio frequency, fractional CO2 lasers, these are like the new treatment modalities which have been used for scarring. So we can definitely take care of the scarring.
Okay. Now, doctor, as you mentioned, these, treatments or procedures are there to take care of these scars or treat these scars. Now, the thing is, there are two places where normally, we see these procedures taking place. One is in the clinic where a qualified dermatologist is there. Other are the parlors or saloons, etc., where people claim that they have anti-acne facials, or, they can, with microneedles, etc., they can squeeze out the acne, or they also have peelings, etc. Now, what would you like to, suggest to people who are facing acne issues?
See, it's a very simple thing. We are doctors. We've been studying the skin for a long period of time in our lives. So we know the inside out of the skin. Those people who are at the parlors or the salons, or आजकल एक वो बहुत common है, wellness clinics.
Yeah.
वहाँ होते हैं, they are not qualified. They have something जो उन्होंने they have learned it from YouTube, they have learned it from somewhere else, from other institutes, or working with someone. They have learned certain tricks and tricks and tics जो वो patients अपने clients पे करते हैं. And mostly, I would say mostly, I am coming across a lot of patients like that who come up with disastrous results. I mean, they burn their face, they cause excessive scarring. And the basic thing is they don't have that knowledge of skin. उन्हें नहीं पता है कि कौन से level of the skin पे हमें act करना है to get rid of the scarring or the acne or the pigmentation per se. They claim everything. वो then next we'll be seeing that they'll be opening their own clinic soon. I mean, but yes, yeah, that I'd like to educate the patient, and I'd like to put it across the audience. I would like to say कि please always check the qualifications of the person जिसके पास आप अपनी skin, specifically अपने face को trust करके जा रहे हैं. When you check the qualifications for your body, then why not the skin? Don't go to these beauticians, these cosmetologists. Please go to a dermatologist only.
Right. I completely, agree with you, because what happens if, for example, if I'm, experiencing chest pain, or I'm doubting कि कुछ problem है मेरे हाथ में, कहीं blockage तो नहीं है, I won't go to anybody. I'll just go to the right person, which is a qualified doctor. If not to a cardiologist, at least I'll go to my family doctor and ask for, advice. Same goes for other internal organs. If I'm having problem with kidney, I'll go to a nephrologist, or at least a urologist, or at least, ask my family doctor, who is again a qualified MBBS. बट द थिंग इज जब स्किन की बात आती है तो हम डॉक्टर के पास सबसे आखिरी में पहुंचते हैं, और तब पहुंचते हैं जब कंडीशन बहुत खराब हो चुकी होती है, क्योंकि हम बहुत ज्यादा सेल्फ मेडिकेशन, ओवर द काउंटर मेडिकेशन, होम रेमेडीज या इन्फ्लुएंसर्स से इन्फ्लुएंस होके अपनी स्किन को बहुत बर्बाद कर चुके होते हैं. So that's continuously, that's why we are continuously saying that it's important to go to the right person at the very first place, which is a qualified dermatologist before it's too late. Skin हमारी body का सबसे largest organ है. We should respect it. That's make us presentable after all. And Aarti Meena is here asking, should I stop wearing makeup if I have acne?
Okay. Yes. No, I wouldn't say stop wearing makeup, but I'd say be very selective about your makeup. Makeup, दो कैटेगरीज क्या, आई मीन देयर मेनी कैटेगरीज, बट स्पेसिफिकली दो कैटेगरीज का आता है. देयर इज वन जो सिर्फ आपको, आई मीन इट्स लो कॉस्टिंग, आई वोंट से लो कॉस्टिंग हाई कॉस्टिंग वाला भी, बट इट इज लो कॉस्टिंग एंड इट विल गिव यू अ गुड कवरेज, but that coverage is actually clogging your skin. I mean, it is making a layer on your skin which is not letting your skin breathe. So as I said before, there's a word known as non-comedogenic. Please do check for that word on your makeup. And yes, if you have active acne, then consult with your dermatologist what all makeup products, or what you can use or what you cannot use. And as I said before, now thanks to the tinted sunscreens which we have in our market, and which a lot of as I said, it's a boon. It will give you that required coverage also, and it won't make it won't flare your acne also.
Right.
So yes,
Right.
inflame.
So you have good products with you. Just go with the right stuffs. And we have one more question from Suman Yadav asking, do breakouts just mean that you don't wash your face enough?
No, absolutely. There is nothing like that, because breakouts, as I said before, there are n number of causes which will cause breakouts. Uh, if you are a female, there is a very high chance that you might be experiencing some hormonal imbalance, which is causing your hormonal acne. A lot of patients, they have acne specifically on during the time of their periods, because there is a hormonal flare, and then it subsides, and it's coupled up with other symptoms. But as I said before, you cannot make it out. As I said, not every acne is similar to the other person. They might have similar symptoms, but the causes are varied.
Right. Ojasvi Verma is asking, how often should I apply face wash in a day? We have already talked about it, but then, and if cleansing is an option, what cleanser is good for my skin? I have a very sensitive skin, and it usually reacts with even natural aloe vera.
Okay. So I'd recommend go for extra gentle or extra mild soap-free cleansers, or foam-based cleansers, and do not rub and exfoliate your skin often. Like even after washing your face, pat dry. Don't rub your face vigorously with a towel. And of course, I forgot to mention it before. Please do wash your towels very frequently, because towels also collect a lot of dirt. I mean, we have a habit of keeping them hanging outside our balcony or out on our terrace, and
Right.
there is a lot of accumulation of dirt and pollution and god knows what all and whatnot. And when we rub our face vigorously with it, we are damaging our skin barrier, as well as we're inviting all those particles to be collected on our skin.
Okay. And before we wind up the session, Dr. Lisa, any take-home message for our viewers?
Yes, I would just, as I emphasized, I would just say, please do not underestimate your skin. Your face is the first thing a person notices about you. So please take very good care of it, and ask help from a dermatologist, a qualified dermatologist who is MBBS, MD, or diploma in dermatology. Please take help from them, and to achieve a good skin regimen. And don't fall for all these nicks and knacks, like apply this kind of face pack and you'll get a flawless skin. Apply this kind of, have this kind of treatment. Don't fall for that. Skin is your face is very important. It's very precious. As I said, it is the first thing a person notices about you. Take very good care of it.
Thank you so very much, Dr. Alisha Zaidi. It was wonderful talking with you. It was a very informative session indeed, and it was great hearing you. Thank you so very much once again.
Thank you so much. Thank you so much.
So we really appreciate for your valuable time, and we are really looking forward for many more such sessions for our viewers in coming times with you.
Thank you so much. I'd like to thank all the viewers and all the people who've asked questions. I hope I was able to answer their queries. And if there is anything, then they can always contact me.
Definitely. Thank you so very much once again. And viewers, thank you for your active participation in today's session. Stay connected with us. Stay beautiful. Stay thoughtless. Thank you. Goodbye. Have a great day ahead.